loose motion, mostly called as a loose motion. Acute means small, gastro means gastrointestinal problem has been occurred. Itis means infection. So patient name will not be revealed. So he is a male patient of 30 years old. The chief complaints what he is saying is loose stools, that is 6 to 7 times a day, abdominal cramping and mild fever for 2 days. So main that can be observed is the loose stools, that is 6 to 7 times a day. Next we'll move on to the vitals. After checking the PPE, that he has 100 by 60 mmHg, which is about normal, and heart rate is 108 per minute, which is quite irregular because 72 should be the normal, but it is more than the 72. So stool examination has been done. So no blood or pus cells. Or pus cells can be, that cannot be observed. If blood, if you see, no, then there might be some bacterial or fungal or viral infection get occurred in the guts. So here there is no bacterial infection. So only no blood can be observed. So after seeing this one, we can come to conclusion that viral gastroenteritis is most common in adults that can be observed. That is nothing but loose motion. And the next, what is the treatment for this will be first general treatment approach according to allopathic. According to allopathic, the treatment goes like this. First, rehydration therapy, mainstay of treatment. This should be the first one because after going continuous loose motion, the water content will be decreased in our body, so body get dehydrated. So to become hydrated, so ORS is generally recommended for the patient. That is oral rehydration solution. Start immediately, give after every loose stools. Small frequent sips means especially vomiting. If the patient is doing vomiting after consuming anything or even after consuming liquid, then he has to take the frequent small sips. First one has to recommend ORS. Next one will be IV fluids, that is Ringer's lactase or NS. If severe dehydration or patient is unable to take oral fluids, means he is not able to take oral fluids, then has to take the that IV fluid salines should be given to the patient, that is Ringer's lactase or NS fluid must be given. Next is the zinc supplementation, that is for in children it is 20 mg per day, that has to be taken for 10 to 14 days. If it is children less than 6 months, 10 mg is recommended. What zinc sulfide is recommended for the loose motion concept. Next one in adults, optional but can be given to boost recovery. So for zinc supplement should be given to the loose motion cases. Next is the antipyretics, means he the patient has complained he has a fever, slight fever. That means antipyretics means which decreases the body temperature. So paracetamol for fever and body ache is recommended. Next, antiemetics means if vomiting is there continuously, that one has to recommend ondansetron, safe and effective. It can combine with that zinc sulfate also. So safe and effective. What is that? Vomiting cases, this drug can be choice, that is ondansetron. Next, domperidone is if needed. It is not so required in patients. So mostly one can recommend the ondansetron in the vomiting cases along with the stool motion. Next, antibiotics only if bloody diarrhea or suggest bacterial infection, high fever or signs of sepsis, positive stool cultural for pathogenic bacteria, example Signella and Salmonella. Only if the bloody stools are observed at that time, antibiotics are recommended. So antibiotics includes ciprofloxacin or azithromycin and metronidazole. These three antibiotics can be recommended only if the bloody stools that can be absorbed in the body. What all the three? Azithromycin, ciprofloxacin, and metronidazole. Metronidazole. And if vomiting is present, then one has to vomiting is present, one has to suggest the previous one. And dietary advice is the easily digestible foods like rice, curd, and banana and toast. And one should avoid milk, fried and spicy foods, and carbonate drinks. So these all should be avoided in the person. Next one is the um, Ayurvedic management. That means in Ayurvedic, loose motion is known as the Atisara. Common drugs that can be given to the Kuta, Kutaja Rishta, that is 50 to 20 ml twice after food. What? Kutaja Rishta, Mustaka Rishta, Kutaja Rishta, Mustaka Rishta, Bilwadi Churna, Nagara Mudha Muska, Shankhavati. If indigestion is present, these can be common drugs in the Ayurvedic. Next, Pathya will be dietary advice: rice gruel, buttermilk with rock salt and pomegranate. Pathya, heavy oil and source spicy milk, cold drinks should be avoided. Uh, this much is the important for the Atisara and general line of treatment. Viral gastrointestinal usually self-limiting in 2 to 3 days. It can go away. Avoid unnecessary antibiotic to prevent resistance. Rehydration is most important in the all the cases. This much is the case one of the acute